Well, I'm Dr. Rick Amy. I'm here with Dr. John Ennen. John and I go way back
Long time.
to school, Cleveland Chiropractic College, Los Angeles, over 20-some plus years ago. So we've been good friends, and being good friends, and I got involved with lasers back in 1998, hard to believe, over 20 years ago, and John was one of the first ones to purchase a laser, and so we've played a lot and done things using lasers for pain and inflammation and all sorts of different things. You treat a lot of different functional medicine, applied kinesiology, organs, and neurolymphatic points and that, so you have a wide range of things you use the laser for. Back in November, I convinced him to upgrade from just a red laser, 635 nanometers, to a combination of red and infrared, and we increased the power where you can adjust it from a low dose all the way to a very, a higher dose. So it actually can produce a little bit of heat. You might see that in some of your patients where they get a little bit warm from that. So the question is, so now that you've moved up, what do you think?
I'm loving it. I'm loving it. It's both decreased the duration in which I have to treat, and it's also amplified the effect of what I'm looking for. So I'm loving that part of it. When it comes to pain especially, pain has been one of those things where you change somebody's pain on the table and they're amazed. So if I'm working on somebody and I put the laser on the areas that we're working with to decrease pain, we're getting phenomenal results, and we're getting in less time, which is huge for patient routing. It's huge for the patient himself. Really big, so if we can see more patients, that's amplifying the effect of the practice.
Yeah, so decrease in time, decrease in pain is very, very beneficial for sure. And I think that power, you're seeing it in different uses. I know you do a lot of neurology. You have this whole room here designed for doing people that have neurological defects as far as learning and education. And I love having that infrared in there to really help potentiate the brain and decrease some of that. So we do a lot. I'm sure you're with brain fog, things of that nature, and resetting neurology after concussions, traumatic brain injuries. I know it'll do a lot with strokes and that. So tell me what you found in using the laser in regards to those particular conditions.
Again, the duration is cut significantly. And as far as improvement of whatever part of the brain we're working with, that's been enhanced as well. Getting better results with consistency of the treatment, and I'm loving it. I'm getting its better effect than other lasers that I've had, and it's also more user-friendly, which I like. If we need to put it in complicated areas, it's small and versatile enough to where we can move it in the areas we want to do for those specific treatments.
Which is great. So we have two different wavelengths, which is the best thing. So we have two different biological effects. The red gives us one biological effect, the infrared gives us another biological effect, which is a bonus. We still have our nice programs with the hertz and pulsations in there, and like you say, the ease of use is always important, but patient results is what makes them compliant, which makes them comes back, what separates us from everyone else.
Absolutely, especially if you work with pain. If you change the pain quickly, patients see that, they're loving it. If you change something like brain fog on an immediate level with it, patients are loving that.
Yeah. Definitely gives them a lot of hope where they've been other places and they haven't seen any results. So the laser's been probably my hammer and my armamentarium for over 20 years, and I continue to enjoy it for treating all sorts of different things.
Yours and I both.
All right. Thanks, John. We appreciate it.
Thanks.